Hello everyone. In this video, we are going to continue the discussion on inquiry. In this session, we are going to talk about the diet and taste. This mainly include the thirst, daily water consumption, appetite, food intake, and taste. As you can see, these symptoms are more related to the digestive function. So the organs related to these symptoms are mostly in the middle jaw and also some in the lower jaw. The middle jaw, the spleen and stomach, the liver, gallbladder, intestines, and jiao. So these are the abnormal condition of these symptoms mostly reflects the pathological condition of these organs. The first one we're going to talk about is the thirst. Thirst is closely related to the water consumption, and this can indicate the situation, the condition of the body fluid in our body, especially the volume, and the distribution of the body fluid in the body, such as the absence of thirst. An absence of thirst indicates the body fluid remains undamaged. So from this definition, you will see when the body fluid remains undamaged, that's actually, in other ways, says this undamaged can describe into healthy or unhealthy but still undamaged, which means we only have a mild deficiency or don't even have deficiency, such as in an unhealthy situation, you don't feel thirst all the time. And in this situation, the patient won't come to you because of they don't feel thirst. Mostly what happens is when they feel thirsty, they will come to you. So the absence of thirst, one situation is in a healthy situation. The patient don't feel thirsty. The second is if the patient suffer from the cold syndrome or the impathogen, the patient may not feel thirsty, and that's why we need to talk about the absence of thirst. Especially if you want to confirm the pathogens in the cold syndrome, dampness, or the syndrome that has no noticeable dryness or heat. These actually are cold pathogens, impathogens. So the cold and dampness do not consume the body fluid. That's because these two are impathogens. So if you want to confirm the impathogens, you can ask the patient, do you feel thirsty? If they say no, you can help you to confirm might from the coldness or dampness. If they say yes, then if your diagnosis is the cold syndrome, then you need to think about if there's something wrong or why the patient will have conflict symptoms, such as if the patient suffers from heat syndrome, the heat, the fire should consume the body fluid, and why the patient don't feel thirsty, then you need to think again about your diagnosis, the pattern, is it correct or not? So the absence of thirst can indicate in the pathological condition. It can be healthy condition. In a pathological condition, it can indicate cold or dampness. The second one, thirst with a desire to drink water. So in this situation, the patient feels thirsty and they want to drink. Why we need to emphasize a desire to drink. When you feel thirsty, you want to drink. Why we need to emphasize these two? That's because we are going to talk another situation that's thirsty. The patient can feel thirsty but they don't want to drink. So we're going to separate these two. The first one, thirst with a desire to drink. This indicates the dryness or heat damage the body fluids. So that's the cause. These young pathogens cause the deficiency of the body fluids in the body. That's why we feel thirsty. We don't have enough body fluids. The associated symptoms of the mild damage, it can be the early stage of external condition, such as superficial conditions, such as patients suffer from winter heat or heat syndrome, with dry mouth, mild thirst, feverish, can have a fever, can have aversion to wind. What happens if the patient have aversion to wind? The patient aversion to cold. Slightly aversion to wind and cold. That indicates the superficial patterns. Sore throats, that's from the heat. That's why the patient will has sore throats. So from the dry mouth, thirsty, sore throats actually indicates the heat syndrome. But if in a very early stage, the patient may present thirst, but they don't want to drink a lot. That's why we say mild damage. If the patient feel thirsty, but with severe damage, they will feel thirsty and they want to drink with the desire of cold water. Why they want to drink cold water? That's because the pathogen is heat. So they want to use cold water to balance them. A high fever, red face, sweating. Why the patient will sweat? That's because the heat in the body can increase the sweat. That's very similar. The picture we showed you before, that's when you cook the water, the steam, you got excess heat at the bottom, so you got more steam on top. That's why you sweat a lot. The surgeon rapid pulse. So this is the pulse from pulse diagnosis. If the patient associates symptom with the heat in the lung and stomach, so they will have insufficiency in the stomach, the patient may present thirst with polydipsia, polyphagia, hunger returns quickly after eating, polyuria, and weight loss. So these symptoms are very common symptoms in diabetes. That's how we understand the diabetes. It can be the damage in the lung and the stomach. And the other one for the internal heat due to insufficiency. So this heat is deficiency heat. The patient, the thirst or the dry throat can aggravate at night, flushed cheek, night sweat, and dry red tongue. So these symptoms actually indicate insufficiency. Aggravate at night, night sweat, that's insufficiency. And why the patient feel thirst? That's because the insufficiency body fluid is a kind of if the insufficiency, it also can be body fluid deficiency. That's why the patient will feel thirst because they don't have enough body fluid in the body. And also the sweating will make the thirst worse because from sweating we are losing more body fluid. First, with a small amount of water consumption. So the previous situation is the patient can feel thirsty and then they want to drink. For this situation, the patient feels thirsty but they don't want to drink a lot, only with a small amount of water consumption. What happened to here is there's no desire to drink. That's because the mild damage of the body fluid, and more common happens in the situation that the patient actually have the damage of the body fluid in the body, but why they don't want to drink a lot? That's because the patient have the other pathogens such as the dampness, damp heat, phlegm fluid. The phlegm is also a kind of fluid that's in pathogens, stagnant blood, and the wound disease. Wound disease we're going to discuss in the differentiation, and doesn't matter the wound disease or not, but in the in levels. So that's the 4 levels differentiation we're going to discuss this session. So from here, you can remember the damp heat, the phlegm, and stagnant blood. The patient, why they don't want to drink the water, that's because because the deficiency of the body fluid, so actually the patient got the damage of the body fluid. They also supposed to have the desire to drink, but the problem is the in pathogens in the body, dampness, phlegm, or the stagnant blood. These, if they drink a lot of water, this water also in liquid. So the water, if they drink a lot, the water going to increase the dampness, increase the phlegm or stagnant blood. So the patient will feel worse. That's why they don't want to drink a lot, but they also feel thirsty. That's why they want to drink, but they don't want to drink a lot. So the patient presents with damp heat may experience thirst with a desire to drink small amounts of water. So this situation, they don't like to drink a lot. But how do you know that's due to the damp heat? That's from the other symptoms. Dampness can have the heaviness sensation, can have a yellow greasy tongue. Yellow tongue indicates the heat, greasy tongue indicates the dampness. Patient with internal retention of phlegm, so they got the phlegm in the body, also may present with this situation of the small amount of water, especially they like to drink hot water, but they don't want to drink a lot. Why they want to drink hot water? Because water is in fluids. Because this phlegm, especially with the phlegm heat, so the patient have the damage of the body fluids, and so they want to drink the water, but the the heat can help to reduce the in pathogen. That's why they don't like to drink the cold water. They want to drink the hot water. So that's the other way to increase the heat in the body. By drinking the hot water. Patients with stagnant blood may experience a dry mouth, but they don't want to drink. That's also because of the water. The stagnant blood is in pathogen. The water also in, so if you drink a lot, it's going to increase the in pathogen. The stagnant blood, how do you know? That's from the tongue, dark purple tongue. Patient with the wound disease in the in level. So this level we can in the 4 levels differentiation we're going to discuss in details what's in level. The patient in this situation, the patient also may feel the thirst but don't want to drink a lot. these two are actually quite similar, because in level, when we study, we will understand that the in nutrition level is also the damage of the blood. It don't have to be stagnant blood, but that's the blood level that's called damage, which means it's the in level that's called damaged. That's why the patient, they don't want to drink a lot of water. Appetite and amount of food intake. These are related to the spleen, stomach, liver, and gallbladder. So these are mostly the middle jaw. That's also where our acquired qi comes from. So that's also why we ask about the appetite in our consultation. We always ask about the appetite, because we want to see the function of the spleen and stomach. Decreased appetite, also known as poor appetite. Decreased appetite means when the patient don't want to eat, or they don't want to eat that much, and sometimes they feel they don't have any taste in the mouth. Contributing factors: the weakness of the spleen and stomach. So this is actually the deficiency of the spleen and stomach. Food retention, the internal dampness affecting the ascending of spleen qi and descending stomach qi. As you can see, these descriptions are actually the transportation and transformation function of the middle jaw, which are spleen and stomach. Food retention, also the transportation dysfunction. So mostly for this decreased appetite can separate into two categories. One is from the pathogen, one is from deficiency. It depends on the other symptoms. Food retention. The patient may have stomach distension and fullness, so the patient will feel something in the stomach because of food retention, a sour or a foul smell from the mouth, from the breath, greasy tongue coating. So these are the symptoms related to the food retention. The thick coating. A thick, greasy coating indicates the damaging or dysfunction of the spleen and stomach. The weakness of the spleen and stomach is also the deficiency. Loose stool, abdominal distension, general fatigue, pale tongue, weak pulse. So these are the deficiency of stomach, especially the loose stool, fatigue. You can see these are actually the deficiency of qi, and the qi, especially the acquired qi, is coming from the spleen and stomach, the middle jaw. Associated symptoms of dampness affecting the spleen includes have a sensation, heaviness, that's from the dampness. So as you can see, when we start, the more we study, we repeat a lot of symptoms. So until now, you should have that kind of reflection. When you see a heaviness sensation, you need to think about the dampness, no matter the sensation in the head or in the body. When you see the description or the patient tell you the stomach fullness or distension, you need to think about the dampness or the qi stagnation as related to the distension feeling, And then in future, when we study the tongue diagnosis, we'll see the thick coating. You will see that the 脏腑 organs have been affected. The greasy coating, you can see this from the dampness or phlegm. So we spend a lot of time in the inquiry to explain these symptoms, the pathogenesis behind these symptoms. The reason why we spend so much time in here in explaining, that's because we want to try to help you to have this kinds of thinking, to practice this kinds of thinking, to understand the symptoms from our theory, and also the more you understand and then the more you study, you will form the reflection, such as if you see the greasy tongue, you will see that the dampness or phlegm. If you see a thick tongue, you will see that the spleen. If you can reflect that the spleen function has been affected, and loose stool, general fatigue, that's the spleen deficiency. So that's why we use so much time to discuss these symptoms. Also, when you study from your textbooks, when you see these symptoms, don't only try to memorize them, because you're going to, if you don't understand the theories or the cause, pathogenesis behind these symptoms, you're going to be confused in future, because we're going to study more and more different symptoms. If you just memorize them, you're going to mix them. So that's why it's very important to understand the pathogenesis behind these symptoms. Aversion to food. This actually means that the patient, they don't like to eat, or even they hate eating. And this can be the dysfunction of the spleen and stomach, especially for food retention and dampness. So for food retention, the patient will present with a sour, putrid breath and gastric fullness distension. So that can be the distension in the abdominal area. This situation also can happen in damp heat of the stomach, especially the damp heat in the stomach. If you present with aversion to oily food, the abdominal stiffness, nausea, vomiting, loose stool, heavy sensation, dampness. So as you can see from the symptoms, heaviness is the dampness. From the dampness, the nausea, vomiting, loose stool, that's the dampness affects the spleen. That's why the patient will have these symptoms. And the other situation is the patient may have the dampness in the liver and gallbladder. In this situation, it also dampness. So the patient also can have a heavy sensation, although although we didn't write here. But for the dampness in the liver and gallbladder, the patient may feel bitter taste, nausea. Why the patient will have nausea? With the dampness in the liver and gallbladder. That's from the wood. In the wood, the relationship between the wood and the earth. So that's also from the 5 elements. That's why in this situation, the patient may present with nausea and the burning sensation in the ribs area. The ribs area is the area where the liver and gallbladder meridian distributes. The yellow eyes is the heat. Yellow skins. The yellow eyes and yellow skins is not, the patient doesn't have to present as yellow eyes and yellow skins. This is actually the symptoms of jaundice. So for aversion to food, mostly happens in patients with dampness, the food retention, or dampness in the spleen or the liver. Apart from these aspects, we can't say the patient is sometimes the pregnancy, women in pregnancy, especially at the early stage, such as especially for the morning sick. The lady also may present aversion to food. So this sometimes is a physiological condition that mixed with a pathological condition. But also for the pregnancy ladies, if they present with severe aversion to food, this also can be pathological condition. So whether or not we're going to use treatments towards the pregnant lady, we need to consider the individual situation. Hunger returns quickly after eating food. This refers to excess appetite with a large amount of food intake, but they feel hungry after a while. In this situation, we will see why the patient, we need to understand why the patient will feel hungry very quick afterwards. That's because the excess fire, especially the stomach fire, this is very similar if you cook your food in a pot, but you got a lot of fire. You turn on the higher heat of your stove, and in this situation, you can cook the food quicker. That's why you eat the food, but you got excess fire in the body, especially excess fire in the stomach. So the stomach can digest the food much quicker. That's why you feel hungry after a very short time. This can happen in diabetes patients, but we don't really use this term. We will focus on the stomach fire. So it can be the symptoms of diabetes. It also can be symptoms of the thyroid problem. But for diabetes and thyroid problem, we also need to find out the cause behind diabetes, behind thyroid. The root cause is the stomach fire, or the insufficiency cause excess fire. So it depends on individuals. Patients with a strong stomach and weak spleen may present with a loose stool, which means the patient has excess pathogen in the stomach, but in the meantime, the patient has spleen deficiency. So the patient may present with excessive appetite. They want to eat, but we have a loose stool. Why we're going to emphasize here? That's because a patient with stomach heat, normally they will have formed stool or constipation. Why the patient will have loose stool? That's because of the spleen deficiency. So if a patient with excess appetite, they have very good appetite, but in the meantime, the patient have loose stool, you need to think about what's the reason. So it might be the excess stomach heat with deficiency spleen. So that's why they have these two conflict symptoms. Hunger with no desire to eat. The patient feel hungry, but they don't want to eat. They don't want to eat. What happened to this situation? That's because the patient have stomach insufficiency. The stomach insufficiency will result in stomach fire or stomach yang. So this deficiency fire can digest the food. That's the internal fire. This is deficiency fire, but although it's deficiency fire, it is still fire, so it can help to digest the food. That's why the patient will feel hungry. But the insufficiency, which means the stomach is weak. The insufficiency also can result in yang deficiency. So the digestive function actually is weak. That's why they don't want to eat a lot. Because when they eat, they will feel distension because the digestive system doesn't actually function well. So they feel the hunger, but they don't want to eat, or they don't want to eat a lot. And the patient also may present with abdominal distension, nausea. So these are different situations, different causes of this pattern. Changes in amount of food intake. A gradual change. This is a very typical situation. If in a disease condition, during a course of disease, the amount of food intake increased gradually. That's actually a sign of the recovery of the spleen and stomach qi, which means the patient is recovering and the function, and the patient will have the acquired qi, which is the nutrition, gradually. They will gain the nutrition gradually. The sudden change in the food intake, especially for patients with chronic severe condition. This is often a life-threatening sign, indicates eroding of spleen and stomach qi. So in this situation, after a long-term disease, especially a long-term disease with chronic critical conditions, so in a very severe situation, the patient don't eat well. The patient always have less food intake, but all of a sudden, the patient everything recovers. They want to eat, and they eat well. This is not a good sign. You need to be careful. That might be the life-threatening sign indicating exhaustion of the spleen qi. Some situation can happen that if a chronic disease is the senior patient, and before they pass away, they might feel better. This is actually a life-threatening sign. And here's a question: that's why the patient, especially for a patient with chronic critical condition, why before they pass away, or that's why we said life-threatening. Actually, that's another way to say this. Right before they pass away, or it can be a certain time or a few days. Why they feel better, why they can have increased food intake in this situation. Actually, you can see some phenomena in the environment. Can you think about any phenomenon that's similar to this? There's one example that if you have a chance, you can try at home. That's the oil lamp. So you light on the oil lamp, and then you don't put that much oil. If you see before the fire is extinguished, if you see the fire of the lamp become brighter right before it is extinguished. So this phenomenon in the nature that's from the lamp we also have similar manifestations in our human life, especially for chronic diseases. If acute, we don't always see this situation. For chronic, for senior patients, sometimes we can see this situation. Sometimes the families will tell you that before their relatives pass away, their mind become clear, their movement become better compared with before, but obviously still in very bad situation. But compared with a few days ago, their relatives might feel better. That's why they can have increased food intake. So for this situation, you need to be careful that you can't tell the relatives that the patient have better food intake, then the patient will be recovering or will be better and better. So that's the exactly opposite direction. So this is something we need to distinguish. The last one is the food preference. This refers to a preference for specific things, such as uncooked rice, soya, or paper. So why sometimes patients eat these funny stuff? Mostly happens in parasitic malnutrition in children. So the specific food intake, especially for these strange things, especially not food, mostly reflects the parasite problem in children. And this will be associated with the weight loss, abdominal pain, or abdominal distension. Another situation of food preference is the food preference of such as greasy food or deep fried food or salty food. So if they always eat certain type of food, such as greasy food, the patient may develop into dampness more. Or if the patient always eats the deep fried food, they always will have excess fire in the body. If the patient always eats like a vegetable or they always eat salad, the patient may have spleen deficiency. That's the food preference. After long term, they can affect the internal organs. So the food preference includes two aspects. One is the specific things, specific objects, some funny objects, not even food, uncooked rice, soil, or even paper. The other is they prefer to eat something. They enjoy eating such as greasy food or deep fried food or ice cream, salad, vegetable smoothie. These preferences, after long term, begin to affect the internal organs as well. Okay, so for the diet to introduce until here, talk about the taste. Thank you guys.